Hello, it's Bill, the knee pain guru. Welcome to the Pain Education Podcast, brought to you by the Camella Foundation. And we are in the second part of our six-part series for natural healing for ACL injuries and tears. It's part of a summer series brought to you by the Camella Foundation. And we have our lovely co-host, Christina Thavos.
Hi.
And we're going to dig in further. We're going to build on the conversation we had last time about, now you've injured your knee. Now what? And we're going to build on that as a way of building more of a comprehensive understanding of approaching a knee injury from a natural and a holistic approach that will get you through that experience much easier with a lot less hassle. So today we're going to talk about understanding your ACL injury. And that's a big piece. We talked about, in the last time we talked about getting an X-ray, CT scan, MRI, finding a good doctor, and then what the doctor's role is in that bigger picture. And now we're going to talk about, well, you've gotten your diagnosis, understanding your injury, how you can begin to further develop your strategy for that. So, Christina, do you have anything you'd like to add on that piece?
Well, if you want to, we can dive right into the homeopathic part. If you hadn't seen the first part of the series, my background is in homeopathic. I want to say medicine, but I hesitate to use the word medicine, but we'll just say homeopathic prescribing and the whole system of homeopathy, which is an alternative form of medicine. And we look at the total picture of what's going on in the person so that we can figure out what medicines to give, what remedies to give that will cause the body to self-reparative mechanism to kick in. So for me, understanding, with our topic today, understanding your ACL injury, what's important is to know what we're dealing with. There's a lot of things that are really important to look at from a homeopathic perspective, like the character of the pain, like where specifically in the knee or other part of the body you're feeling it, when it flares up, like how you're changing emotionally with the pain, but also knowing exactly what it is. Like if it's torn cartilage, I'm going to give a different remedy than if it's a torn ligament. And
well, I think you bring a good point, because a person can have both.
Exactly.
And so this is what we're going to dig in. We're going to,
I don't know how deep you want to go, like with that, but those things are really important. That's why, like the diagnosis, knowing what you're dealing with the knee pain injury from the homeopathic perspective, as well as from the perspective that you're coming from, Bill, it's pretty important.
Well, sure. Absolutely. And from my approach, my background is all around from an osteopathic perspective, which is structure governs function. That when the body, the structure is in place, the body has the best opportunity to heal. However, it doesn't necessarily mean it has the resources to be able to heal. And this is where I believe, and I know in my own knee injury experience, homeopathy did play a role, albeit a very small role at that time, because I didn't understand how it could have supported me through the process. Because when I blew out my knee, I was like, my knee-jerk reaction was anger. I'm pissed off like you wouldn't believe. And because it was like, my body's not working the way it's supposed to, and I don't understand what's going on. So knowing what I know now, I know there is a specific remedy for what had happened for my knee, which was full ACL tear. And this was, of course, after 4 knee dislocations. I think we touched on that in the first one. My learning curve was a little flat. I was pretty stubborn. I want to stick my head in the sand and not deal with it. So I dislocated my left knee the first time and was like, oh, it's okay. I'll walk it off. And the second time, and it got worse, and I dealt with it. And the third time, and I'm like, oh, geez, something is wrong. Maybe I need to do something about it. Until finally, the fourth time, I got carried off the softball field and was like, I probably need to go to the doctor and find out what's going on. And so I got progressively more frustrated and angry at my situation, at my knee, and what was going on. And I also had a fear of not wanting to look at what had happened to my knee. I didn't want to know. I wanted to know, but I didn't want to know.
Right.
So I understand sharing that type of story with you. There's a specific remedy that could have supported me through that process that wouldn't have been so difficult.
It definitely can help ease that emotional, like mental component, which of course, like when your mind is calm and your nervous system is calm, you have more resources to go in towards your healing. So like you make better decisions,
Right.
you know, that last time too, you know, especially like when you get into emergency situations or you're getting pressured by doctors to decide right now and you're a mess, you know, emotionally and mentally, you don't make a good decision there. We've all been in situations like that. We know how to relate to that kind of situation. So that's one of the beauties of homeopathy. It's like it doesn't suppress how you feel. It's not like taking a Xanax or taking antidepressant or an anti-anxiety medicine, you know, that turns off the symptoms without addressing the underlying cause. The homeopathy causes the body to self-regulate and starts to remove whatever's causing it to go into the wonky state in the first place.
Right. And I think about it, to have that type of support after my first knee injury, I probably could have avoided the next 3 knee dislocations, which would have meant I would have only had partially torn the knee, the
Yeah.
ligament, the ACL in the knee. And my healing approach would have been completely different than having to have a full blown patella replacement of the ACL. So you see what I'm trying to put myself in this place with the support of homeopathy at the very beginning. You know, an ounce of prevention is worth a pound of cure.
Yeah.
And looking at it in hindsight and going, oh, well, I could have avoided myself a lot of grief. I could have been back on the judo mat a lot faster. I could have approached it completely differently, and it wouldn't have been such a difficult experience.
Well, 2 cases are coming to mind because you're right. Like at the very least, the homeopathy would help you have avoided a less severe relapse. You know, it would have shortened the healing time and kept things from being as bad. One case, I had a client that just had constant neck and shoulder problems and was going to the chiropractor on a weekly basis for adjustments because it wouldn't hold. And she'd been doing this for, I don't know, like 2 years at that time when I started working with her. And one of the things we found was some suppressed anger, you know, along her case. And, you know, so I put her on a remedy that was addressing that. And within a couple of weeks, she was so happy. Like at her first follow-up, she's like, I'm having a weird thing happen. She's like, my chiropractor said the adjustment held better. And it hasn't held like that in 2 years. So over the course of a few more months of working with me and working with the remedies, the chiropractic adjustments were holding for longer and longer. So she was going, you know, like after, I don't know, 3-4 months, she was going a month in between visits with pretty good holding. So the remedy made the environment, it made the structure hold the function better. Or maybe, Bill, you can explain that better, but it gave the soil what it needed so that it held better and the structure was able to do what it's supposed to do.
Yeah, that like bones come out of place because of tension on the tendons, ligaments, fascia, muscles. And when those tension patterns that are created by our thoughts, by our feelings, by our attitude towards things, by our mindset, then those adjustments that the chiropractor would make have to deal with that tension in the body. So if that reoccurring thought pattern or that reoccurring emotion happens, then those things get pulled out easier and more quickly. However, if you shifted the mindset, you shifted the emotions, and those thought patterns, the mindset, all of that doesn't come back as quickly, well, then absolutely, then the adjustments can hold for a lot longer period of time.
Now that case was more of like a chronic thing that was going on with her, like it wasn't like a specific injury that happened or an accident or anything like that. It was something literally she'd just been dealing with for years, and it was very uncomfortable and causing a lot of distress in her daily life. Now the second case I wanted to bring up was actually a snowmobile accident, and I got the call at like 1 o'clock in the morning, because this was back when I still had a home phone. The phone rang. And you're woken out of a dead sleep, and she had landed on her shoulder. The snowmobile had tipped over. She landed on her shoulder. It was an excruciating pain. And so I started, based on what she was experiencing, that every movement was painful, we gave bryonia. Her sister was there, like making remedies for her, and she was getting a lot of relief. Now, it wasn't for 3 days she's dealing with this pain, but not taking any pain meds, simply using the homeopathic remedies. She goes to the doctor after 3 days. They x-ray. She has a compound fracture. Mm-hmm. One was separated by this much in her shoulder, and she'd been dealing with this with only homeopathic remedies for 3 days. So I love how this case shows the power of remedies, well-chosen remedies, to mitigate pain, to make you comfortable enough to deal with, such a severe injury like that.
Mm-hmm. Yeah, and that absolutely, the smart thing to do in that situation would have been to go to the doctor right away to check out what was going on, that was in the first podcast. So the homeopathics are powerful. However, we have to put them into context with a holistic natural approach, which can include Western medicine.
Definitely.
So the next piece I want to get into is the fact that not all injuries are created equal. And that's what's really important. And this is what we alluded to in the beginning when we first started today's podcast. You can have, the knee could be sprained, it could be strained. You can have a partial tear of an ACL. You can have a fully torn ACL. You can have other elements of the knee that are affected. We mentioned about you could have torn meniscus, which is what I had, 2 pieces of torn meniscus in addition to a fully torn ACL. You could have torn cartilage. You can have a fractured or broken bone in the knee as well. You could have torn tendon or torn muscle. So that's why it's so important to get that diagnosis from the doctor, so you know exactly what you're dealing with. So if there is something broken, for instance, like the collarbone separation craziness that was happening, that the doctor can set it. They can get things in place so the body can heal itself. Once again, structure governs function. It doesn't matter how many homeopathic remedies you take. If you have something that's out of place, that's not, the likelihood of it healing is very slim. So we want to put that into perspective.
Go
ahead.
Coming back to that case with the broken bone that she didn't know that she had, what changed in the treatment plan after that was not the pain relieving remedy, which also reduces the inflammation, but we also added a remedy to help the broken bone to start setting itself and to heal, which also level of pain relief. So that's where that, changed, the approach for me changed with knowing what her diagnosis was and what we were actually dealing with.
Totally. So that's the value of the diagnosis, bringing that into your holistic approach and seeing how getting the specificity from the doctor, from the x-ray, the CT scan, the MRI, the ultrasound, whatever is needed to get a correct diagnosis from the Western medical model is going to be key in terms of getting your knee injury to move in the direction that you want it to move. I'm looking at my notes here. There's also, is it just the ACL that's torn? There's other ligaments in the knee, the MCL and the PCL. So the ACL is the anterior cruciate ligament. The MCL is the medial cruciate ligament, and the PCL, the posterior cruciate ligament. Those are all other ligaments that can get torn. And pardon?
Lots of pieces and parts in there working.
Right. To bend your leg, there's a lot going on in the knee joint. So when it hurts, we have to understand what exactly is hurting. Is the patella fractured in addition to a ACL tear? Are there more ligaments torn in addition to the ACL tear? Is the meniscus torn? Is there a fracture somewhere else? So we want to know exactly what's going on with an official doctor's diagnosis to be able to develop the plan to get you out of pain, get the body healed, and then make sure you're resuming normal activities.
Yeah, and I just want to say too, we've spoken a lot about getting a diagnosis, and sometimes what you find, it's not as much, you're not going to see it with the ACL, but for anybody who also is watching this and interested in like the approach that you take, Bill, and the homeopathic approach that I take, that if the doctor can't give you a diagnosis because they don't know what's going on, and you don't know, there is still some level of help that can be done, with homeopathy and but like the pain relief that I was able to give this woman that broke her collarbone, but I couldn't set, that wasn't helping the bone set. That wasn't going to solve that her bone was separated. Do you understand? So either one of what we're doing is completely ruled out because the doctor can't figure it out either. Because sometimes you find
and it's important to recognize that a diagnosis is nothing more than an educated guess. Like it really is. Doctors are very good at what they do, but it's also, there are limitations to what a doctor can do. And as long as you fit inside that box, they can help you. But if you fit outside of that box, for instance, what Christina was sharing, as far as if you've done the x-rays, the CT scans, the MRIs, you've gone to physical therapy, you've taken the shots, and you've done the pain killing, the prescription drugs, a lot of times there's really nothing wrong on a physical level, even though you feel pain. And this is important to get the mindset shift to understand that pain is a feeling. A pain is an emotion that can't be identified on an X-ray, a CT scan, or MRI. So we have to make the distinction between the pain and the structure that is broken or torn. And if it's not broken or torn, then we're just dealing with pain. We're just dealing with irritation of nerves that are the width of an eyelash in your knee that are being squeezed, sending a signal to your brain that you have pain.
Right. And it could also be limited range of motion and, other things that aren't working right without having something broken, torn, or.
Sure. And you could think of what's been affected. When you're talking about nerves, you're talking about the brain, the spinal column, the nerves that go to all parts of your body to give you the sensation. of heat, cold, pain, whatever experience you have through your physical body, it comes through your nervous system. And you could think when you have an accident, an injury, a surgery, a trauma, it's like a fuse got blown in the fuse box. And now it isn't quite working right. The body will do a workaround. It'll compensate. It'll hedge for the experience of the injury. And when that happens, you can still have physical pain, but there's technically nothing wrong. The doctor won't have an official diagnosis. They'll say it's sprained or strained or something like that, which is probably true. And after the body goes through the healing process, the pain will still be there. The hedging will still be there. The compensation in the body will still be there. Yet it doesn't know how to heal because the nervous system hasn't been addressed. The neurology that needs to be reset, like going to the breaker box or the fuse box and resetting the breaker, that will allow the neurology to get to a place of being comfortable again so you can move forward. But this goes into the equation of the holistic approach, that we need to know what we're dealing with first. Sprain, strain, partially torn, fully torn, something fractured or broken, or and what is it? Right. When we understand that, we absolutely want the medical model in that conversation to help you with that process if you need a surgery to repair it. And I did forget something in this process, which is, what is the outcome that you want? Like, that's really important, because it's kind of like lining up the archery shooting. You got to line up with the target. And if you're just pulling the bow and arrow back, but you're not aiming at the target, well, then the arrow can land anywhere. So it's important. What is the outcome that you want?
Yeah. What were some examples?
Well, like, you want to take your age into consideration. When I blew out my knee, I was 28. And there wasn't anything in my mind that said, I don't want to compete judo anymore. I don't want to go to practice. I don't want to lift weights. I wanted to live my life like I was before. So I didn't have it in my mind that anything other than getting back to the life that I had before was an option. Mm-hmm. Now there are plenty of athletes who have functioned in their lives, the rest of their careers, been physically active without an ACL, without a ligament. There's a number of NFL players, football players, who have played without ACLs, which I have a real hard time comprehending that, knowing my experience with my knee. But there's a tremendous amount of strengthening you need to do in the leg in order to build that stability around the joint.
So there's things you can do with, like, working out and physical therapy to, like, compensate for that.
Compensate for the fact that you don't have an ACL anymore. But for me, I would step wrong, step on uneven ground, something like that, and the knee would give out. And it just wasn't a fun experience. The very last time, I was just throwing a ball to first base. That was it. Threw a ball to first base, the knee popped out. I was on the ground screaming, holding my knee to my chest, and I had no idea what happened. I'm like, what did I do wrong? So I would do anything not to have that experience again, because it was awful.
Sure.
So with that, repairing the ACL was a must for me. I wasn't going to be able to go without the rest of my life without an ACL. Just the way it felt when I walked, tension in my hips and lower back, the inability to fully flex my heel to my butt, that whole process was just, it was kind of a nightmare, and I didn't feel um, complete as a person, not having the knee function like I wanted. So my outcome was done, like back to what it was before my knee injury. I've had judo buddies that didn't have ACL, that they tore their ACLs. They didn't do standing work anymore. Everything that they did was all on the ground, and they can get away with it just fine. And they went into old age, they're perfectly fine with it. Different people change their activities that they do. So you want,
On the ground, there's different poses and things that you do, like when you're standing versus the work that's like groundwork or grappling type
yeah,
stuff.
it's a standing and twisting and moving and trying to throw people in different ways. That was standing work. So you're more reliant on your knee, your foot and your knee to be able to twist and all of that, where you can do groundwork, which is fighting on the ground, on all fours or on your back, and it isn't so dependent on your knee
Stability.
stability. Correct. Yeah. So uh, seeing like where you're at, take your age into consideration, your activity level, what you like doing, what you want to do on the other side of things. And this way, when you're sitting there and the doctor is looking at you, well, what would you like to do? Do you want to have surgery? This is what's going on. You can take that into consideration to determine if the surgery is going to work for you, or no surgery is going to work for you, or just doing physical therapy. There are other options other than the surgical route, the Western medical route. Once again, Christina had spoke. Pardon?
Includes physical therapy. The,
You cut out just a little bit.
the Western medical route includes physical therapy. There's other choices beyond physical therapy, is what I was saying.
True, true, but there's still exercise. Like people could go to the gym and strengthen their legs, but we want to have a little bit more depth to that understanding, in terms of the approach to bring balance back to the body, so the body functions the way you'd like it to, and that's all dependent on what's the outcome that you want. So anything to add there, Christina, regarding some of the elements that I was sharing?
Yeah, the thing that was popping in was, coming back to the subjective experience of what you're dealing with. When you were saying that, there may not be anything physically wrong, like nothing torn or broken or anything, but you're in pain. You have limited range of motion, you have limited functioning. And your experience could be completely different than the next guy that has the same thing, nothing physically wrong, torn, broken, or anything like that, but they're in pain. So these subtle and subjective experiences that we feel are really where the beauty of homeopathy and the approach that you're taking, Bill, working with like people in knee club and working with people, and other like in-person appointments is so powerful and really beneficial, because we're looking for those subtle things and your subjective experience and what's going on, and make those adjustments based on that very, very individualized approach, which you don't really get from, Western medical models. So that's, I just wanted to bring that up because it's such a glaring difference between how we work versus how people in the medical system work.
Absolutely, there is. And that's part of the bigger plan. That's part of the bigger strategy, and that you can do elements of it. There's lots of people that I work with that I'm working with them while they're going to physical therapy. We're just taking what is going on with physical therapy and how physical therapy makes their knee feel, and strategically creating comfort, getting the pressure off of the nerves that are the width of an eyelash, uh, in the context of the larger picture of what is going on, their exercise, their daily activities, whether they go to work or not, whether they work from home, if they're sitting a lot, they're standing a lot, they're walking a lot. All of that is going to lead to different tension patterns that are going on in the physical body that needs to be addressed, that we need to flip the breaker on the fuse box so we can get the neurology in a relaxed place so the body's able to heal more
Yeah.
quickly.
I really think just keep bringing home that you've got so many choices. There's so many other choices that you may not have known about, and helping your neurology calm down so that you have the time, the bandwidth to like go into looking at those choices, trying things that you haven't tried before, and just taking a really centered, grounded approach to it, and knowing that you've got options. So
Sure. And this reminds me of that, what is the story about the three blind men all touching an elephant at the same time and giving a description of it? And one was touching the trunk, and one was touching the body, and one was touching the tail. And they were each giving a different description of the elephant. And they were all drastically different. And it didn't mean any of them were wrong. It just meant they had a different perspective on the bigger picture of what was going on. And I think that is super important to understand, that how I may look at an ACL injury from my own experience is going to be completely different than how Christina looks at an ACL injury from her experiences and her training. And a doctor would look at an ACL injury from their training. That's an important perspective to take into consideration in developing your bigger picture, your strategy in terms of a natural approach to getting the knee out of pain. And
we'll
that's
the next podcast too.
What was that?
Talk about this more next podcast, and developing a strategy.
Right. Yeah.
They're super valuable. And I'll just put the teaser out, like how to see when there's holes and gaps in the strategy that you're currently using. That'll be really important to talk about next podcast.
Yeah. Yeah. There's a lot of different things. There's so many things to look at. And this, I'm going to go back to what Christina was saying before. When you're approaching your knee situation, you aren't going to recognize those gaps if you're in a place of fear, if you're panicking about it, if you're tense and worried and concerned or upset or whatever that is around the knee injury.
Or just pushing through because there's an underlying fear of what really could happen. So you're just going to push. I'm going to get better. That's right. Look at that too. That's a symptom also.
Sure. So anyhow, we'll address that. We'll go into a lot more depth in that in the third series. So like Christina said, we're dropping a teaser now for developing that strategy for your knee for ACL injury. Let's see. Sounds like we're complete for today. So Christina, do you have any closing thoughts, words on things?
Just drop in the Camella Foundation and signing up for the Camella Foundation newsletter, the camellafoundation.org. And you can reach out to both of us to build.
Anything else regarding the topic we were talking about today? Okay, great. So thank you all for being here. This is Bill Paravano, the knee pain guru, and Christina Thavis. Thanking you for being here. This is the Pain Education Podcast brought to you by the Camella Foundation, and we will see you on episode 3 of this 6-part podcast series on natural healing for ACL injuries and tears. Thank you all so much. Have a great day. Bye-bye.